All right, so get this. We've got this case, right? This medical mystery had us all scratching our heads back in the ICU. Imagine this.
Hmm.
73-year-old woman shows up, and her confusion, it's like getting worse every single day for the past 4 days.
Yeah, at first it sounds like, pretty standard encephalopathy, like altered mental state.
Right, exactly. But hold on, because trust me, things get a little crazy.
This is where it gets really interesting. Even the senior doctors, they were totally stumped. And then in comes Dr. Mike Hansen, with his secret weapon.
ADH.
ADH, yeah, the most accurate medical AI out there in the entire world.
And I still remember seeing it happen. Dr. Hansen, totally calm, just puts all the patient's data into the system, and bam, 1.9 seconds later, ADH just spits out this diagnosis like nobody saw it coming.
1.9 seconds, it's insane. It's like some kind of medical Sherlock Holmes or something, solving the case in the blink of an eye.
It's wild, right?
Yeah.
But before we jump to the big reveal, let's break down the case, because trust me, it's a wild ride.
Okay, so we've got this 73-year-old woman. She's got a history of osteoarthritis, type 2 diabetes, the usual hypertension. And she's been taking 1,000 milligrams of acetaminophen every 6 hours for years, for her chronic pain. On top of that, she's on metformin, lisinopril, and then the occasional ibuprofen.
Okay, so this might seem like a small thing at first, but it actually becomes super important later. But the patient's daughter mentions that, her mom hasn't been eating well, lost around 10 pounds in the past 3 months or so.
Yeah, it's like one of those subtle clues that can easily get missed, but ADH, it picked up on it right away.
So the patient initially, she's mildly confused, oriented to person and place, but she's complaining of nausea, feeling sick. But things escalate really fast.
Day 2, her lethargy gets worse. She's only oriented to person now, and she even develops a low-grade fever.
And then day 3 hits, and that's when the alarm bells really start going off. She's barely responding, only to painful stimuli, and she's tachypneic, breathing.
Tachypneic. Well, that's definitely AI sounding, because this is an AI-generated podcast. But what they were trying to say was tachypnic, which means the patient is breathing fast. So normally we breathe anywhere from 12 to 20 breaths per minute. But when you're breathing 25 to 30 or more per minute, then that's really fast, especially if you don't have a reason to be breathing that fast, like from exercise. So yeah, 25, 30, 35, that's definitely fast and concerning. But let's hear the rest of the medical case.
Really rapidly.
Yeah, that rapid decline, it's a huge red flag. Something serious is definitely going on.
Totally agree, because by day 4, she's completely unresponsive. They need to intubate her, for airway protection, the whole 9 yards. They rush her to the ICU,
Yeah.
and the initial workup shows, okay, her temperature's 38.2 degrees Celsius, fever's definitely there, her heart rate's 102 beats per minute, blood pressure 142 over 88 millimole HE, respiratory rate is 26 breaths per minute, so that tachypnea is confirmed.
And her labs, well, they're even more concerning. Her anion gap is 25 milli EQL. That's way elevated, which
So what the AI was trying to say was anion gap. Anion gap, when it's elevated, typically more than 12 or more than 16, depending on the lab, more than let's just say 16 for this purpose, that would be considered an elevated or high anion gap. So we call that HAGMA, or HAGMA, high anion gap metabolic acidosis. And when we think of what causes that, we typically use the acronym or the mnemonic called mud piles, where each letter in that mnemonic stands for something. And in some cases, one letter like P actually stands for 3 different things: propofol, propylene glycol, and one other that applies to this case, which I'll not give away at this moment.
points toward metabolic acidosis. Bicarbonate is low too, which further supports that. Glucose is a bit high, but not enough to make us think it's diabetic ketoacidosis.
Her ammonia level's a bit elevated, and her white blood cell count is high, which could mean infection. So the medical team, they're thinking, could it be sepsis, maybe diabetic ketoacidosis, or even hepatic encephalopathy, considering her history.
So they run a bunch of tests, but nothing really definitive comes back. They even check her acetaminophen levels just to rule out an overdose, and that comes back normal. So the mystery just keeps getting deeper.
And this is where Dr. Hansen's instincts and all his experience really kick in. He's going over the case, and he's just got this feeling that something's not right. like a pattern's hiding in plain sight, something subtle but really important in the patient's history, her symptoms, and those lab results.
It's those three critical signs we always talk about, the ones that signal the brain's in trouble. In this case, it's a textbook example.
You're right, those three signs, learned about them back in med school, it's all about recognizing the patterns most doctors miss. So remind us, what's the first sign?
First sign is the rapid decline in mental status, which we definitely see here. The patient went from like mild confusion to unresponsive in just a few days.
And that leads us to the second sign, which is the unexplained metabolic acidosis. Her labs clearly show her body's acid-base balance is messed up, but they can't figure out why.
And last but not least, the third sign, a history of chronic medication use, especially when you consider other health issues. In this case, it's the long-term acetaminophen use, and then you add in the poor nutrition, and that raises a huge red flag.
So Dr. Hansen, with all his experience, he's putting all these pieces together, these seemingly random clues, and he knows something's off.
Yeah.
And this is where ADH enters the picture.
Exactly. He feeds all the patient's data into the AI. And remember, ADH is famous for being fast and super accurate. It's like having this medical supercomputer at your fingertips, ready to go.
And in like a mind-blowing 1.9 seconds, ADH just throws out this diagnosis: pyroglutamic acidosis.
Pyroglutamic acidosis, yeah, it's a rare one and often misdiagnosed too. This metabolic disorder that can look like a lot of other conditions, which makes it really hard to spot.
So what exactly is pyroglutamic acidosis, and how did ADH manage to connect all the dots in this case? Well, we'll get into that right after.
No.
Oh, no break.
No break. We're just going to keep going, keep this momentum up.
Okay. Sounds good. So pyroglutamic acidosis, what is it, and how did ADH solve this puzzle? Let's get into it.
Okay, so pyroglutamic acidosis, not exactly like a common cold, right?
Not exactly, yeah. I remember vaguely reading about it in med school, but it seemed like so rare, you know?
It's definitely one of those zebra diagnoses, the ones that are like super rare, easy to miss. But here in the ICU, we got to be ready for those zebras, especially when we're dealing with encephalopathy, you know?
For sure. So break it down for us. What's actually happening at the like cellular level with this pyroglutamic acidosis?
Basically, it all comes down to this buildup of pyroglutamic acid in the blood. It's like a derivative of an amino acid, and, you know, amino acids, those are the building blocks of proteins. And usually our bodies, they can handle a little bit of pyroglutamic acid, no problem. We've got enzymes that break it down.
Right. But in this case, something's messing with that breakdown process, right?
Exactly. And as this pyroglutamic acid starts piling up, it just like wreaks havoc, especially in the brain. That's why our patient was having all those severe neurological symptoms, like this super fast decline in her mental state.
Makes sense. So how does this like seemingly harmless substance suddenly turn into such a big problem?
Well, pyroglutamic acid, it kind of messes with brain chemistry, you know, like it can disrupt how neurotransmitters work and even mess with how brain cells produce energy. It's like throwing a wrench in the gears of the brain. Everything goes haywire.
Got it. Now, we talked about how chronic acetaminophen use and, you know, not eating enough can be risk factors here. But how do those things actually lead to this buildup of pyroglutamic acid?
All right, let's connect the dots. Remember glutathione. It's that like super powerful antioxidant our bodies make to protect ourselves from damage. Think of it like a superhero fighting off those nasty free radicals.
Yeah, glutathione, it's like our body's natural defense system, right?
Exactly. And here's where acetaminophen comes in. When we take it, our liver's got to break it down. And one of the byproducts of that breakdown is this toxic substance called NAPQI. But normally, glutathione swoops in and neutralizes NAPQI before it can do any damage.
So glutathione is like NAPQI's kryptonite.
You got it. But there's a twist. When you use acetaminophen for a long time, especially if you're not eating well, it can drain your glutathione stores. It's like our superheroes getting overworked, tired, can't fight off the bad guys anymore.
And if you don't have enough glutathione, that NAPQI can build up and start causing problems, right?
You're catching on. And that damage can mess up a whole bunch of metabolic pathways, including the one that leads to, you guessed it, the buildup of pyroglutamic acid.
Right.
Remember how the patient wasn't eating much, losing weight? That probably means she wasn't getting the nutrients she needed to keep those glutathione levels up.
Wow, so it's like this chain reaction, long-term acetaminophen, not eating enough, leads to low glutathione, which lets NAPQI run wild, and bam, you end up with pyroglutamic acidosis.
Yeah.
Crazy how things that seem totally unrelated can cause such a complex problem.
It really is, and that's one of the reasons why pyroglutamic acidosis is often missed. Those connections, they aren't always obvious.
But ADH, With its like superhuman ability to analyze tons of data, it managed to figure it all out in just a few seconds. It's like having a medical detective who knows everything about medicine and can think a million miles a minute.
That's a great way to put it. And in the ICU, where every second counts, that speed and accuracy, it can literally save lives.
Okay, so ADH, it nails the diagnosis, right? But what about treatment? What happens once you know it's pyroglutamic acidosis?
First things first, got to address the root cause. If it's meds, like in this case, you stop or adjust them. If it's from not eating enough, then getting the patient the right nutrition is key.
And are there like specific treatments that target the acidosis itself?
Yeah, meds like sodium bicarbonate. Those can help to rebalance the acid-base levels in the blood. And sometimes, depending how bad it is, you might need things like dialysis.
So it's a multifaceted approach. You got to tackle the underlying cause, meds to fix the imbalance, and of course, lifestyle changes.
Exactly. And that's where, the human touch in medicine is still so important. AI can give us amazing insights, help us make decisions, but ultimately, it's us, the doctors, who got to apply that knowledge to each individual patient, considering their specific needs and everything.
It's not about AI taking over. It's about AI empowering doctors, giving them better tools to diagnose faster, more accurately, and ultimately provide better care.
100%. It's about using technology to boost our expertise and improve patient outcomes. That's the goal.
In this case, it's the perfect example of how that collaboration can lead to some pretty amazing results.
Absolutely. And speaking of results, remember those 3 critical signs we were talking about? The ones that tell us the brain's in trouble?
Oh yeah, the rapid decline in mental status, the unexplained metabolic acidosis, and the history of chronic medication use. Those are the red flags that should always make us think twice.
Okay, so these AI generated podcasters, basically they're spot on with everything, but they're obviously getting a couple of things off there. So we already discussed a couple things that they messed up, but one of the things that they should specify, they should have specified in this case, which ADH AI knows, but these AI podcasters didn't know or didn't specify, I should say, was that that third critical sign wasn't just chronic medication use, it was specifically acetaminophen use. So typically the story goes as someone who is elderly, especially a female, maybe not eating so much, so poor nutrition. They have chronic pain to the point where they're taking this Tylenol or acetaminophen essentially round the clock, every 4 hours or every 6 hours, typically 650 milligrams or even 1,000 milligrams of Tylenol at a time. And as you do this day after day over time, that's what leads to this glutathione depletion and potentially pyroglutamic acidosis. And the problem is once you get to that point, it's very dangerous and scary because there's essentially no hope to come out of that hole once you're in it, unless you got some really, really sharp doctors who can pick up on the diagnosis and fix the problem, because it is easily fixable once you recognize it. So that's what makes this so powerful, is that the ability to save someone's life that otherwise might not have gone saved if it weren't for this intelligence.
Even if the initial presentation seems pretty straightforward.
They're like warning signs telling us to dig deeper, look beyond the obvious. And ADH, with its crazy pattern recognition skills, it can help us see those connections that we might miss otherwise.
This case really shows how powerful it can be to combine human expertise with AI's analytical power. It's like a glimpse into the future of medicine.
And for anyone listening who's interested in learning more about Dr. Mike Hanson's AI ADH, you can check it out at app.drmikehanson.com.
Great resource if you want to learn more about the cutting edge of medical technology. This case really highlighted how AI is changing the game in healthcare.
Totally agree.
But it's not just about AI, right? It's about the human element too.
Right. It's that balance, the collaboration between human intelligence and artificial intelligence.
It's like a partnership where both sides bring something unique to the table.
Exactly. And this partnership isn't just limited to diagnosis. AI is already making waves in other areas too, like personalized treatment plans, drug discovery, even robotic surgery.
It's a crazy exciting time to be in healthcare, especially with AI on our side. The possibilities, they're endless.
And remember, this is only the beginning. AI is getting smarter all the time, so we can definitely expect even more breakthroughs in the years to come.
I mean, think about it. In 1.9 seconds, ADH made a diagnosis that could have been missed. Imagine if every doctor had that kind of power.
It would revolutionize healthcare. Fewer diagnostic errors, catching diseases earlier, better treatments, better outcomes for patients.
Sounds like a dream come true. But is AI really the answer to all our problems in medicine?
It's not a magic wand, but it's definitely a game changer. It can analyze mountains of data, make connections that we miss, and think of possibilities that wouldn't even cross our minds.
But what about the human side of medicine? The empathy, the intuition, the connection with the patient. Can AI ever replace that?
That's an important point. AI is meant to work with doctors, not replace them. It's about giving doctors better tools so they can focus on what matters most, building relationships with their patients and giving compassionate care.
So it's not AI versus doctors, it's AI and doctors working together.
Exactly. Think of it like an orchestra. The doctor is the conductor leading the way, and AI is this powerful instrument adding depth and richness to the music.
I love that analogy. It really captures the idea of this partnership, this synergy between human and machine.
And this synergy goes beyond diagnosis. AI is already shaking things up in other areas too. Personalized treatment plans, drug discovery, even robotic surgery.
It's amazing to think about all the potential. With AI by our side, the possibilities are limitless.
For sure. And remember, this is just the start. As AI keeps getting smarter, we can expect even more amazing things down the road.
It's wild to think how far we've come and how much more we can achieve. This case is just a small taste of the incredible innovations happening in healthcare technology.
It really is.
Well, I think that's a great place to wrap up our deep dive into this fascinating case and the incredible potential of AI in medicine. If you're as excited about this stuff as we are, I encourage you to explore further.
Absolutely. And if you want to learn more about Dr. Mike Hansen's AI ADH, head over to app.drmikehansen.com.
It's a fantastic resource for anyone who wants to delve deeper into the world of medical AI. As always, thanks for joining us on the Deep Dive. We'll see you next time for another exciting exploration into the world of science and medicine.
All right, so yeah, that's a wrap for this video. Definitely check out ADH if you want to use it, learn more about it, etc. There's actually so many amazing things that are coming with that that you can learn more on the website. But the long story short of this is that the when you combine the power of the human brain, in this aspect, a doctor who brings that human element to the table of not just human intelligence, but also empathy, et cetera, that these AI podcasters were talking about. And then you combine that with this incredible medical intelligence. I mean, when you combine the two of those, it's really just off the charts level of medical intelligence and ability to solve cases, improve patient care, and ultimately improve lives and save lives. So I'm super excited about this stuff. The potential is enormous. And yeah, join me for the next video because we're going to do more videos like this. And let me know your thoughts about all of that we discussed in this video. Put them in the comments below. And I'd like to see what you have to say about it. So thanks for watching.